to break for just a moment. I am back. Um, we were also looking at other barriers to getting accurate daily weights. Um, Up until we changed our policy on this floor, we were really missing a lot of patients. Uh, Being rushed in documenting, sometimes you get it put in on the wrong patient or you transpose your numbers. The hospital's really been working diligently to become more collaborative with each department. So, pharmacy often will call and they've noticed a change in a weight, and they will call and say, "Are you sure this is accurate?" Because they're trying to dose a cardiac drip or they're trying to dose Lovenox for VTE. Um, we also have to have accurate weights for sepsis protocol and for giving boluses. So they will call and we will go reweigh the patient just to verify that what is in the computer is correct or we need to change it. Nutrition assessment, the dietitians will often, they look at the patient's weight, skin integrity, depends, can the patient's weight can be determined on how well their skin integrity is going to be, what size bed we need to have them on, radiology, scans. There's a whole area that depends on a correct patient weight, not a stated weight from the patient, because I'm really not going to tell someone what my real weight is. I'm going to make up a really good number. That is human nature. So we need an actual weight. And by using the same scale at the same time of day, typically, yes, it's better to have it in the morning before breakfast, after the patient has gone to the bathroom and weighed them. But for this unit, looking at all of the areas that it was crucial to have a weight within, 8 to 12 hours so that they could determine what they need to do for their patient were our cardiac surgeons. Because our open heart patients have a lot of fluid excess after surgery. So they really need this weight and strict INO to determine how much and how well the Lasix or Bumax is working to pull that fluid off. So that is why we chose to do it in the evening at, I think it's 9 o'clock at night. And as long as it's the same day, it's consistent with the same scale. A stated weight is not acceptable. And it's not acceptable to not document how the weight was obtained. It needs to be documented and it needs to be consistent in how it's taken each time. Also, by doing the daily weights here on the unit, since the majority of our patients do have CHF as a history or they're in with CHF, it is important for them it kind of reiterates to them that they need to do their daily weights once they go home, and it opens up conversation for us to talk with them and educate them about the 2-pound weight gain from one day to the next, and they need to contact their doctor. We are really pushing to educate the aides, since many of them are nurse externs in nursing school, the importance of getting daily weights. Do you have any questions?
No, I mean, I think those are all good points that we do on our unit and that we've kind of changed over the past few years.
We also calibrate our scales once a year, or if we feel like something's not right, this is like a 10-pound difference from the last weight this patient had, we'll get another scale to recheck it, and if it shows a different number, then we have that scale recalibrated to make sure that it's weighing correctly. I think that's it. Did you learn anything that you did not know?
Well, especially about like the calibrating, I didn't realize that we calibrated them like that. That was kind of the main. And I do agree with our nurse externs. You know, that's a big, important factor in educating them, since they're in nursing school, about how important weighing and like for CHF management and all that is. So.
Well, and how vast
Mm-hmm.
the departments, like radiology and for scans, pharmacists, dietitians,
Yep.
the physicians, they count on us to have a correct weight documented,
Right.
so that they know how to adjust their medicines. The pharmacist counts on that to give the right
Mm-hmm.
dosing, and dietitians count on that to see whether their nutrition, assessments and what supplements or whatever they are giving, is it helping, is it not helping, of the patient's skin integrity.
Mm-hmm.
Depends on if they have fluid overload, then okay,